Coming on to the assessment, now most patients who come to us will not just come to us, they must have tried a lot of creams, they must have tried a lot of other things, they must have tried a lot of natural remedies, and finally they seek the plastic surgeon advice as to what can be actually done for themselves. So when it comes to the aging look, the first things that happens is actually the drop in the mid face, where you have the deep middle parallel fats descent. That's because all the ligaments attachments it lose, and then what is actually here begins to fall. So this is the first assessment. What we do is to see how much of it is actually sagging. Then we also look at the nasolabial folds. We also look at the marionette folds over here. We look at the jawline, and if you can see over here, there is the sagging of the midface over here. Things which are supposed to belong here are like this. And because of the sag, it also making the nasolabial folds look a little prominent. And there is a little bit of marionette, not too bad, but even that can be better. And look at the jawline. If you look at the jawline, probably a patient long ago must have had a very tight jawline, but with the aging process, you can have the jowling over here, which is actually can be corrected with the non-surgical treatments that we offer precisely the threads. So, and then you also must look at the periorbita, which is another can see signs of aging in the form of probably the teardrop line, which could be prominent. Also, some people will have a lot of fat bulges over here because of the laxity of the ligamentous support. And so all this can be probably concerning the patients, and it's the patient who chooses, not us. So we will talk to our patient and see what is the real concern for herself, and then we will take it forward. So what's the exact thing you're looking for in terms of doing something for your face? So what exactly do you see for yourself?
It's supposed to make it look tighter.
Make it look tighter? Okay. So
and then some like little marks that's just there.
The
That's
marks?
just appeared there.
Okay. Okay. So two issues over here: the aging process, which she's mentioning about, as well as the pigmentation over here, which we'll address it subsequently. But as far as the aging is concerned, I agree with you that you need something tighter over here. That will do. We use threads to actually lift up, at the same time volumize. So different types of threads are available to actually do the same thing, to actually volumize and at the same time lift it. So I've got techniques which address this fold, and also techniques to address this fold. And the beauty of the threads is it also gives you hyaluronic acid, which is like a filler within the threads. And additionally, if you want some amount of support to the ligaments, you can also do a filler just to get your cheekbones nicely highlighted. So that's the plan for you to do threads which can be folded up, and to also address the marionette line, and to address the body of the mandible here, to lift all these things so that you have nice support. And the threads which we use are the Aptos threads, and these have barbs, and they last for almost 2.5 years.
Okay.
And they also have hyaluronic acid. So these are the only threads available which have hyaluronic acid. So very good. And because of the longevity, most plastic surgeons across the globe would use the Aptos threads.
That was my next question. How long will it last?
2.5 years. Okay. This is the George Suleimanidze was the person who created the threads. He's having experience of close to 40 years in this field, and he says all our threads are manufacturing happens in Georgia, and everything lasts 2 years. So what he's saying,
And you've not had any infections or anything?
No, because these are all closed techniques. They're not open techniques, and the threads are so inert. There's no reaction to it, and it's just to make a small hole,
Okay.
and maybe make a hole here, maybe make another small tiny hole, and do all that stuff.
Yeah. And it's not visible?
No.
Yeah. Okay.
Nothing will be. Okay. So that's what it is now. Let's quickly do the marking. Now we draw first of all the orbit. That's the cheek junction. Okay. And then we draw the the nasolabial fold over here, and then the marionette line. And then if you see, this is the jowl over here, right? And then we'll have to see where are our entry points. So now, first entry point would be the tragus. Just in front of tragus, make a crease line over here, and from here we can probably go address the top part, address the second part over here, address the third part over here. And now the second thing is, now you can draw the zygoma, which is over here, a little bit arch, and then above the arch you have another point of anchoring. So you just lift it over here, and then you have one anchor point just 1 centimeter over the in front of the hairline. That's the point, and from here we draw 2 points actually coming here and over here to address the jaw definition. So this is what we will be doing on each side. So the vector is vertical here, and the horizontal vector lies over here to get this up like this. And then we would be using a small filler to just to highlight the cheek zone 1, 2, and 3 definitely, just to highlight the cheek. So this is the vector over here, and the same thing is repeated over here. Draw the lid cheek junction, draw the nasolabial fold over here, the marionette over here, and then again do the jowling. It's not much over here. There's a little bit of asymmetry, more prominent that side, and then you do the points of entry, and this is over here, 1, and over here you'll have to push it up and then see where it is, and you can probably take it above the zygomatic arch, which is over here, and somewhere over here we take 1, and then we could do 1 line like this, another line like this, just to lift this, and then we would do the nasolabial, the topmost part, which is over here, and the second one is over here. Second is over here, and the third one is over here, lifting the marionette line over there. And then we have the horizontal vector and the vertical vector, which we plan on this side. So that's what it is, and this is going to give it a nice look. And then probably we'll be doing a little bit of filling of the cheek zone 1, 2 definitely, and 3 depending on how much we require. The advantage of using the threads are it reduces the quantity of the fillers. Otherwise, you might have to use much more fillers to actually get an effect than to use it along with the thread. So the threads makes it more robust, makes it more versatile, reduces the cost. You really look at it, because threads are going to last for a longer time, whereas the fillers may not last that time. So we first of all reduce the amount of fillers which are requiring. Probably in my experience, around half of the fillers which we reduce, because we are already getting the effect like this. Okay, so that's about it, and this is the assessment which we plan, and then we obviously do it under local anesthesia, keep her comfortable, and then we go ahead with the procedure. Thank you. So this is the Visage Excellence Threads, and this comes in a sterile box like this, and you can actually open up. So this is the Aptos Excellence Threads, 19 centimeters, and comes in a box of 10 threads, and it's got 5 threads here and 5 threads here. So we plan to use 2 vertical threads and 3 horizontal threads on each side. And these are the needles which are used to make the punctures and pass the threads. Okay. So we'll start with giving local anesthesia. Might sting a little bit in. So this has 2 needles, and this is actually for making a puncture to enable the threads to get passed through this, and the other needle is for actually the local anesthesia over here, the long needle, and this again we make the puncture and we infiltrate with this. So this is for anesthesia. Okay, the first puncture is going to be 1 centimeter, which you mark over here, and only one small poke over there, and that's it. One poke over here. Yeah. And one poke over here. Over here. and we'll have to make the entry for these 2 threads over here. That's done. And then another puncture for here. And then probably route it over here like this. This is my anesthetic pen, okay? So give it a pause. I'm going to be using very little anesthesia, and that's the thing over here. And you can see that I'll just be using a little bit over there, and then keep extending it. Yeah, and that's it. Just very little. Okay. Again, progressing there, little bit. Again, progress, little bit. Again, progress, a little bit there. Progress, a little bit there. That's it. So I've just used just around 1.5 cc's over here. Okay, that's all we're going to be using. And if you can show me the same thing over here. Again, you just turn that side. And again over here, the same thing. Effect. So that's my first thread, the vertical thread. We're going to be using 2 threads here, and then that's a thread. And what I'm going to be doing is going in the deep plane there and kind of lifting. Yeah, kind of lifting and lifting. And we go right up till here where we have to catch the dermis over here. Okay, that's the dermis there. Right, just to lift the jaw. Okay, and then from here onwards we come, lift it up. Again, the second thread is directed into this. Yeah. Same thing, go deep, and then as you keep going towards the jaw, come onto a very superficial plane there, over here, and then hold the dermis and then lift it up. Okay, so that's one thread, right? Yeah, that's one thread, right? Maybe the second thread is, it's again the same. So every line gets 2 threads just for better support and lift. And then same thing over here. We go like that on a deeper plane and go catch the jowl there. Okay, and the dermis, and then lift, lift, lift. Keep pulling it up. You want the lift there, and then move to the second direction. Okay, and then again the deep plane, not too superficial, not too superficial, but deeper. And there you are catching the dermis there. Okay, and then lift, 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 and come. Okay, next we're going to be using the horizontal direction, and then we're going to be doing this. Deep there, and then once you come to the nasolabial fold, it has to be very superficial here. That's the thread there. Okay, I caught the dermis there, and then you push it out and backwards. Similarly, we'll have to go here. And going, catching the upper part of the nasolabial fold there. Okay, that's the dermis, and then we are going to lift it back like this, and there it is. That's the lift which we got here. You can see the now the skin is actually crumpled over here. That's the lift we got. Okay, so that is between first and give me the marker please here. Then we go on to the second thread now. The second thread is going to be passed again. Yeah, deep, deep, deep. Yeah, and we're going to catch the nasolabial fold there at the dermis, and then
It's
yes,
it's
that's
sore.
it.
It's sore.
Okay, okay. I'm removing that, and then we go down now. And then again we go into this. Yeah, and then we caught the nasolabial fold there, and that's the dermis there, and we pull it back. The last thread, we're going to be using it for the first and the second one, okay, and that is we're using it for the first one there, okay, the dermis there, and then get it down like this, and then redirect it into this second line, which didn't receive both the threads, and there we are at the nasolabial, engaging the dermis, and then lifting it now. Yeah, that's it. You see this? Right? I can see the pull. Okay.
Yeah.
Now, as I'm doing this, I'll engage all the clogs like this. You can see this. Can you see this? Give me another artery. And do that one over here. You see this? So even this is being pulled. Okay. I'm pulling both to get the maximum effect, and that's what it does. See this?
Dissolve, or how does it work? Like
After 2.5 years,
they dissolve.
we cut those threads. So that's that, and then this thread has to be also cut off.
Chin up in this box. And it's okay.
Okay, this is done. Yeah, turn to gently towards that side. Gently. Yeah. Opening over here, and then we make that. And then we also make another.
Last thread and we are done.
We're done. Thanks, Eddie. You've been very,
You did a
very
fabulous job.
cooperative and very nice. Yeah, not even wincing.
Mhm.
So that's a little on a deeper plane, and then we go on to the nasolabial fold, catch the dermis there, okay, and then lift it, and then I engage into the first route. See the lift now which we get, okay? I'm lifting it, engaging all the threads. Give me some ointment, and cut the excess threads. You see this? It's getting pulled. Now we do just the augmentation of the cheek, zone 1 and zone 2, probably zone 3, and then we do the fill. On here, just to get that look. Okay. So Voluma, we'll put up here. Yeah. So one syringe. The first thing what we have to actually do is take off the little bit of air there. You can see that the air is being removed and the filler is there. I'm going to be giving maybe 0.5 here and 0.5 there. So maybe each side I'll give 1.5. Okay. So just go bang on the zygoma. That's the zygoma. Okay. And then I give around 1.5 there. Yeah. And then again I give here, okay, and 1.5, and then over here again. All right. Okay, everything is done. Looking nice, pretty. Yeah. All right, thank you. See the jawline over here? See the jawline over here. It looks now straight, and this is